Hi, and welcome to today's lecture video on G6Pd deficiency, a genetic disorder that impacts red blood cells and may even complicate your dietary choices if you have this disorder. So stay tuned and let's unravel the biochemistry, delve into its symptoms, diagnostic methods, and management. Let's get started. All right, so we're going to start with the basic idea of what free radicals are. Free radicals are simply unstable atoms that are formed in the body, that is in the cells. So here we are looking at a free radical in a red blood cell. Why is this a free radical? If you take a look at the outer shell, you can see that this electron is paired. This electron here is unpaired, right? And this is why this is unstable, and this is called a free radical. So they are harmful because they have the potential to damage the red blood cell wall. They can damage the proteins in the red blood cell. This means that red blood cells face the ongoing threat of free radicals on a daily basis, right? Now, in order for the red blood cells to prevent such a potential cell damage, they are also equipped with protective, robust arsenal of antioxidants. So here I want to mention glutathione, which is a substance that is used by the red blood cells to neutralize these harmful free radicals. Okay, so red blood cell antioxidants, for that matter, glutathione, donates an electron here to the free radical, and by so doing, it stabilizes it and it averts its damaging effect to the red blood cell. However, in the case of G6Pd deficiency, that is the enzyme G6Pd is lacking. All right, why is this of importance? This specific enzyme lacks, and therefore it's actually essential for maintaining adequate levels of glutathione. So there will be deficient antioxidants in the red blood cell. Therefore, there would not be any electron donation to the free radical, and the free radical can render these red blood cells vulnerable to oxidative stress, that is cell damage and red blood cell hemolysis. Yep, I know you're saying this slide looks ridiculous with complex reactions, but actually it's a very easy slide. So I'm going to explain how electrons are donated to the free radicals to prevent potential damage to the red blood cell membrane. I'm going to start with the enzyme glutathione reductase that plays a key role by reducing NADPH right here into NADP+. Okay, so in doing so, NADPH is able to donate an electron to the free radical, stabilizing them and thereby aborting any potential damage to the cell membrane. Meanwhile, glutathione reductase is also able to convert oxidized glutathiones into reduced glutathiones, okay, which with the help of glutathione peroxidase is actually able to convert hydrogen peroxide. Now, this hydrogen peroxide is a source for forming very reactive free radicals. So it is essential to convert them into non-harmful substances like water, okay? However, the enzyme that is necessary for regenerating NADPH is actually called G6PD. Okay, this is the disorder that we are interested in today, G6PD deficiency. So without G6PD, you realize that the regeneration of NADPH is actually limited in such a way that there is going to be a lack of donation of the electron to the free radical. So in G6PD deficiency, or when a person lacks G6PD, the critical electron donation and stabilization of the free radicals becomes impaired, leading to oxidative stress, that is red blood cell membrane lysis, and ultimately hemolysis. Among the myriad of factors that may predispose individuals to oxidative stress and hemolysis may include infections, and this is because they incite a heightened immune response with the production of free radicals. Spectrum of medications may also introduce unpredictable interactions with the body. Additionally, right here, dietary choices, particularly the consumption of fava beans, have also been associated with the potential for oxidative challenges, particularly in vulnerable populations. But other food agents like red wine and soy products may also be implicated. Also coupled with conditions like metabolic acidosis, All these factors create a complex conditions where vigilance is paramount in patients affected by this disorder. In the clinical manifestations, patients often remain asymptomatic until they encounter oxidative stress. When exposed, these individuals may experience acute hemolytic anemia characterized by a rapid onset of symptoms such as fatigue, pallor, alongside jaundice. In some cases, hemolysis can further lead to signs of renal insufficiency. In the investigation of G6PD deficiency, G6PD enzyme assay is pivotal. However, it is crucial to note that during episodes of severe hemolysis, reticulocytes are elevated. So reds are young red blood cells and they usually exhibit high quantities of G6PD enzyme. And what is the effect? So this can potentially lead to a falsely negative test result. Laboratory findings indicative of hemolytic anemia typically includes an elevated indirect bilirubin as well as reticulocytes, and there is going to be a decline in haptoglobin and hemoglobin. Coombs test is expected to be negative, and this is to exclude autoimmune hemolytic anemia. Peripheral blood smear can provide vital insights revealing bite cells, for example, or Heinz bodies, as you can see. So Heinz bodies are sort of small dots of denatured hemoglobin, and blister cells may also be seen. Additionally, assessing renal function is also very essential alongside a thorough review of any precipitating factors that could have led to the oxidative stress. In regions with high incidence of G6PD deficiency, proactive newborn screening is conducted shortly after birth to ensure early, that is, detection of G6PD deficiency. The effective management of G6PD deficiency hinges not only on medical interventions but also on robust patient education that highlights the significance of recognizing and avoiding risk factors for oxidative stress. It is crucial for patients to understand that certain substances such as methylene blue must be strictly avoided to prevent hemolysis. In the event of severe hemolytic anemia, timely interventions such as blood transfusions and hydration may be essential to restore stability. Additionally, should acute kidney injury arise, hemodialysis might be required to support renal function. So, by fostering awareness and proactive care strategies, patients can effectively navigate their condition and mitigate associated risks. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.